Hey guys, we're going to be looking at a randomized control trial that is titled No Added Benefit of Combining Dry Needling with Guideline-Based Physical Therapy when Managing Chronic Neck Pain. If you just look at the abstract of this study, it talks about how they were treating chronic neck pain. They were looking for pain and disability. Those were their primary outcomes. They were either doing guideline-based physical therapy or guideline-based physical therapy plus dry needling. And then they measured it at 1 month post randomization. They also followed them for 3 months and 6 months. Their secondary outcomes were global perceived effect, quality of sleep, pain catastrophizing, and then self efficacy. There were 116 patients. And what they found is that at 1 month post randomization, people who received dry needling plus guideline based physical therapy had a small reduction in pain intensity for the previous 24 hours, and they had better pain at 1 week. There we go. Average pain intensity in the previous week was also better. But there was no effect of adding dry needling for disability at 1 month, and then there was no effect on any of the secondary outcomes. So their conclusion was when combined with guideline-based physical therapy for neck pain, dry needling resulted in small improvements in pain only at 1 month post-randomization. There is no effect on disability. If you just look at that, it looks like dry needling has no long-term effects, but we have to look into the methods of these studies as well. So going to the actual study, with the background, they talk about how treatment guidelines for chronic neck pain include a multimodal approach, which is manual therapy and exercise. There's conflicting recommendations for other modalities like dry needling. While some authors do not recommend it, others say that there is moderate strength of evidence. Their goal of the study was to determine if there was an added benefit of combining dry needling with guideline-based physical therapy to a program consisting of exercise and manual therapy on pain and disability in patients with chronic neck pain. Participants, they had to have at least a 3 out of 10 pain, and they had to score at least a 15 out of 100 on the Neck Disability Index. As for exclusion criteria, if they had a nerve root compression, pregnancy, self-reported diagnosis of tendinopathies, fibromyalgia, or if they were on antidepressants or anticoagulants, they also were excluded if they had anything that would exclude them or contraindicate dry needling for them, such as an infection or fever, hypothyroidism, wounds in the area, metal allergy, cancer, or fear of needles. All right, randomization. They did randomize these pretty well, actually. So there's a researcher who was not involved in any other aspect of the study. They had sealed envelopes. You guys get the point. It was randomized pretty well. They even said that they wanted to have an equal number of people. Yeah, so the participants were allocated to a 1-to-1 ratio. So they separated them by like low pain to high pain. So you guys can see into low and high pain intensity, meaning they wanted to have like a good amount of people in both the dry needling group and the non-dry needling group. They wanted to have people that had kind of like every level of pain. So it really was well randomized. That being said, the intervention, they had 4 to 6 consultations over 4 weeks. 4 to 6 consultations means they had between 4 and 6 treatments. Therapists could use manual therapy and or exercises for their neck pain. And this was based off of whatever the therapist found. So they maybe did only manual therapy, or they did only exercise, or they did a combination of both. The pivotal aims of the intervention was to reduce neck pain, improve strength of the neck and upper back muscles, improve range of motion, and then educate the patient. As for the dry needling group, along with conventional physical therapy, their goal, and this is where we kind of start to get into some problems with the study. The goal of the dry needling technique was to needle the muscles in the posterior neck, which included the upper and middle trap, the cervical multifidi, the splenius cervicis, and the levator scapula. They did this at the end of each session. They did this by determining which muscles needed to be treated after assessing for the presence of nodules that were hyperirritable and hyperalgesic to palpation in those muscles. Now, between all of these muscles, you might be able to feel trigger points in, let's say, the upper trap, in the splenius cervicis, in the levator scapula, all of which could be valuable. That being said, really the most important muscle that we need to be treating in the spine is the multifidi. Now, you cannot palpate for any trigger points in the cervical multifidi. They're too deep, and we have a 3.3 to 6.6 centimeter error when we're palpating for trigger points. Those muscles are really, really small, so it's very difficult to actually find a trigger point, especially something as deep as the upper trap. So that's the first problem that we find in this study. Along with that, they said that the needle is introduced subcutaneously, penetrating the skin 10 to 15 millimeters of depth. Now, if you guys look at some of the other research reviews that I've done, you'll see that in a cadaver study and in an ultrasonic study, they found that you could get to the cervical multifidi with a 40 millimeter needle, 40. They're using 10 to 15 millimeters. Now, depending on the size of that person, you might not even make it through the upper trap or even adipose tissue. If there's a lot of adipose tissue on that patient, you're not even making it through the fat before you get into the muscle. But we know for sure with a 15 millimeter needle, you are not going to reach the spine. You are not going to reach the cervical multifidi. Continuing on, they say that they manipulated the needles in order to obtain a localized contraction response, meaning they're looking for a twitch response. After that first twitch was identified, they did vertical pistoning without rotation of the needle in order to obtain 6 additional twitch responses. So a few problems here. One, they're looking for a twitch. A twitch isn't everything. It is nice to see though. That being said, rarely are you finding a twitch when you're going down to the multifidi. You might get a twitch in the upper trap. So they're really just getting into the trap. Along with that, they did vertical pistoning. So remember that if you do a vertical piston, if you go up and down into a muscle fiber, that is actually shown to cause a little bit too much damage into the muscle, meaning you're not going to get the best outcomes. Along with that, they specifically did not rotate the needle. It says without rotation of the needle. Rotation is one of the best things you can do with the needle. If you rotate that needle, you get the adenosine release. You're able to promote more blood flow to the area. It's really one of the best things you can do with a needle. And if you do not rotate the needle, you do not get those mechanisms in effect. So they did subpar needling. They used too small of needles. And remember what we found in that abstract. They actually still had better short-term outcomes. But we'll look a little bit more into that. Okay, so now moving on to the primary outcomes. So primary outcomes, they measure this at 1 month post-randomization, average pain intensity in the previous 24 hours and in the previous week, and they measure disability on the Neck Disability Index. What they found, they're just talking about the outcomes here. We'll talk about results in just a little bit. As for secondary outcomes, they looked at pain and disability at 3 months and at 6 months. They also looked at the global perceived effect. We'll talk a little bit about that. They looked at quality of sleep. They looked at pain catastrophizing, and they looked at self-efficacy. That was at 1 month, 1 month post-randomization, and then 1 month, 3 months, and 6 months post-randomization, All right, so that global perceived effect is a -5 to a +5 scale. 0 means no change. +5 is they are 100% better. -5 is you completely disabled the patient. So it's a self-reported scale where the patient will say how much better they think that they got. Adverse effects. They talk about any adverse effects. What they found was that, so they say adverse events were classified based off severity, which was serious, significant, or mild. And from what I remember, there wasn't really anything except for soreness. We'll talk about that in a bit. Here's the statistics. Now going to the results, again, there were 116 subjects in the actual study. Most of the participants were female, but 72% of them were female. And the groups were similar at baseline for all other characteristics. So neck pain for the previous week and disability, they say that the groups were similar at baseline. And then we're looking at now the mean number of treatments. So the physical therapy and the physical therapy plus dry needling groups had a mean number of 4.8 and 5.1 treatment sessions respectively. So if they had needling done with the PT, they had just a slight bit average more treatment sessions. Effect on the primary outcome. So at 1 month post-randomization, the dry needling plus physical therapy group provided a small reduction in pain intensity in the previous 24 hours, and they had better average pain intensity over the previous week compared to PT alone. Remember, they did a really, really poor job putting these needles in, and they still had a small reduction in average pain intensity in the previous 24 hours and in the previous week. for disability, there was not a significant change. So really it had no effect on disability. As for secondary outcomes, there was no between group differences for average pain intensity in the previous 24 hours at 3 months and at 6 months. So 3 months and 6 months, there was really no differences in outcomes. And then there was no differences in the global perceived effect, quality of sleep, pain catastrophizing, and self-efficacy. Adverse events, no serious or significant adverse events were reported. Mild adverse events were reported in some of the PT group and some of the PT plus dry needling group, but these were temporary exacerbations in neck pain or headaches, which you'd kind of expect. Pretty low risk doing PT and even PT with needles, especially with these tiny little needles that you can't really make them worse with needles that are this small. Discussion. This is where it becomes a big deal, because this is what you're seeing quoted online when people talk about this study. Adding dry needling to guideline-based physical therapy resulted in a small, not clinically meaningful reduction in average neck pain intensity at 1 month post-randomization, but not at 3 months or 6 months in participants with chronic neck pain. Adding dry needling to guideline-based physical therapy had no added benefit for disability, global perceived effect, quality of sleep, pain catastrophizing, and self-efficacy. And then right here, clinicians should not consider dry needling in addition to physical therapy as an approach to managing chronic neck pain. Of course, I can't highlight it because I'm recording right now. This is a really big deal, this part of their discussion, whereas they say you should not consider adding dry needling because they're saying it didn't work. I would almost argue the exact opposite. I would say that if you inserted tiny little needles in your patient, one, we already know from here that the adverse events really not a big deal. Like they might get a little bit increased soreness. But if you're helping them with pain in the previous 24 hours, if you're helping them with pain in the previous week, that's a big deal. Because if you can get those short-term outcomes, I think it gives you a lot more of an opportunity to get long-term outcomes with that patient. Otherwise, if they don't see any results, they're just not going to stay on your schedule. You're never really going to get them any better. But that being said, you use tiny little needles. If you can get them even a little bit better, maybe you can help them with their sleep. They only measured sleep, I believe, at 3 months and 6 months. But if you can help them with their pain, they likely can sleep better. And they're talking about them utilizing just traditional PT with needles, but they didn't talk about any manipulation in any of these. And we know that cervical manipulation can also help with symptoms, which we can get into in the future. That being said, I would argue that if you used larger needles, if you used better technique, meaning you didn't piston, but you put those needles in, you wind those needles, you set them up to electrical stimulation, I think you'll have a lot better outcomes with your patient. Also, remember, adenosine, which only is released by winding the needle, adenosine is the same thing that caffeine is trying to inhibit the binding of. If you can get an adenosine release, anecdotally, I've seen it significantly improve quality of sleep in my patients, especially the closer that you are to the head and neck region, usually the better that they'll sleep. So adenosine is a vasodilator, it can help with pain, and it can help with sleep. Well, maybe that's one reason why they had no effect on quality of sleep. They weren't able to affect their pain as much as they really could have, but they also didn't promote a chemical that is supposed to help you with sleep. That's something definitely to consider, that if they just use better technique, I can almost guarantee you they would have better results. Short-term reductions in their pain were not sustained at long-term follow-up. And then booster treatments have been suggested as a means to facilitate long-term maintenance of beneficial effects. However, they say that you should not do that because people with chronic neck pain observed in the short term, people that observed pain relief in the short term, where it was not clinically important. Again, if you use better technique, I would highly argue that would have had different results. So conclusion, when adding guideline-based physical therapy, when added to guideline-based physical therapy for chronic neck pain, dry needling resulted in small, not clinically meaningful improvements in pain at the short term, but not in the long term. Dry needling did not improve disability, global perceived effect, quality of sleep, pain catastrophizing, and self-efficacy at any time point. And you guys can see same idea in the key points. You can see that their findings, no effect on disability. Like they literally said in the study that they would not recommend needling, like right here. They literally said that you should not consider dry needling in addition to physical therapy. Again, if you only read the abstract, you wouldn't really notice. If you only read the abstract and you saw that, one combined with guideline-based physical therapy, dry needling resulted in small improvements only at 1 month, you wouldn't realize that they used really crappy methods for this study, and they still had better effect on pain at 1 month post follow-up. Imagine how much better the results would have been if they used properly sized needles, if they actually got to the cervical multifidi, if they used electrical stimulation, if they wound those needles, if they didn't do pistoning. Way better results that they could have achieved with this study. So when you guys are seeing results of a study and they're saying that needling does or does not work, I would highly recommend that you look at the methods of that study, because there have been really poor studies done on needling that I've seen, both that I've recommended for it or against it. But if you guys really dig into the weeds, you will see that the studies that say that needling doesn't work consistently have been really, really poorly done studies. So please look into the methods of the study, how they actually did it. Do not just read the abstract and think that you read the whole study. If you guys have any questions, please let me know.